Welcome to New Patient and Family Orientation class. Our top priority is the health and safety of our patients and employees. To prevent the spread of COVID-19 infection, we have changed how we offer some services. At your visit, some services and amenities mentioned in this video may be limited or closed for the time being. More information about COVID-19 and how your visit may be affected is available online. In addition to viewing this information online, you may attend the New Patient and Family Orientation class in person at MD Anderson. The class is led by a member of our patient education team and is offered at 2 p.m. on Mondays, Tuesdays, and Wednesdays. You do not need to register to attend. If you have questions about this class, contact Patient Education. You can call or email us at the phone number and email address listed on your screen. The purpose of this class is to give you information about practical things. You may not need to know everything today. We want you to know what resources and services are available and where you can find information when you need it. Two other resources that may be helpful to you are the First Visit Guide and the Resources and Services Guide. If you don't have copies yet, ask your care team for them at your next visit. MD Anderson provides care at several locations throughout Houston. Care locations include the Texas Medical Center, League City, Sugar Land, The Woodlands, and West Houston. Our locations at Memorial City and the Women's Hospital of Texas offer certain surgery services to patients. Even if you plan to receive care in the Texas Medical Center, you may be able to have blood work and diagnostic exams at other locations. If you are interested in learning more about care options at other locations, ask your care team. You can also find more information and a complete list of locations online. As an MD Anderson patient, you have a care team made up of specialists from many different areas. It can be helpful to know how your care team is organized. Most patients have a primary care center that depends on their diagnosis. Each center focuses on treating a certain kind of cancer. At the Texas Medical Center, care centers are located in the main building and Mays Clinic. You may want to save your care center's phone number in your phone or keep it somewhere easy to find. Then, when you have a question, you won't have to search for it. You and your doctor in your primary care center make the decisions about your care. This doctor is also called your attending physician. It can be helpful to make a list of the questions you want to ask your doctor. The First Visit Guide booklet offers help with thinking about what questions you may ask. In addition to your attending physician, there are many other people who make up your healthcare team and are ready to support you. We'll review some of them together. To see a more complete guide to your care team's roles and the uniforms they wear, see pages 4 through 7 in the First Visit Guide. Most doctors work closely with an advanced practice provider. Sometimes we call them APPs for short. Advanced practice providers also wear white coats and are trained and educated similarly to physicians. Your medical care team includes a nursing team who may work with medical assistants and technicians who have different types of training. The nurses, medical assistants, and technicians you meet will depend on the type of care you receive. Next, you have a pharmacist. He or she provides information about your medicines. Make sure you ask your pharmacist about any questions you have about your medicines. To see a list of our retail pharmacy locations, look in your Resources and Services Guide. There you will also find information about how to properly dispose of your unused or expired medicines. Your complete medical care team depends on your specific needs. Your doctor may refer you to see specialists in other areas. For example, we have a team of occupational and physical therapists who help patients achieve their best physical activity. In addition to providing medical care, your care team includes people who provide other kinds of support. A dietitian is available to answer your questions about what to eat. Dietitians can also give you a nutrition plan that complements your care. You have a social work counselor who can assist in many ways. He or she can help you cope with stress, provide additional support, and help you find other resources that you need. Social work support is for patients and caregivers. They also provide support programs for kids. Every patient has a patient advocate who is available to help with concerns. Remember that you have the right to voice your concerns or complaints at any time. Your patient advocate can talk with you in a confidential setting and help you understand your rights and responsibilities. To meet with your dietitian, social work counselor, or patient advocate, contact these departments directly to schedule an appointment. Your care team includes the people who manage the practical aspects of your care. This includes a patient access representative who may talk with you about financial parts of your care, including your records and insurance coverage, patient services coordinators who schedule your appointments, and a case manager who may communicate with your insurance company about what services you receive at MD Anderson and why. Your doctor may talk with you about certain clinical trials at MD Anderson. Clinical trials are research studies in which patients may volunteer to take part. MD Anderson uses clinical trials to find better ways to prevent, diagnose, and treat cancer. If your doctor has not talked with you about clinical trials but you are interested, be sure to ask. If you would like to learn more about clinical trials, there are other resources to help. It's common to be unsure about how clinical trials work and what it means to be in a clinical trial. To learn more, ask for a copy of the booklet Clinical Trials at MD Anderson. This resource explains how clinical trials work and may help you know what questions to ask your doctor. You can also learn more by visiting the Learning Center or on the website clinicaltrials.org. Based on your needs, your doctor may refer you to a specialty center at some point in your care. Specialty centers provide specific services and treatments. Some examples of specialty centers are the diagnostic imaging clinics, pain management, cancer prevention, and integrative medicine centers. The staff members you meet at specialty centers are also part of your care team. Remember, you and your doctor in your primary care center are responsible for making decisions about your care. The Integrative Medicine Center is a specialty center with therapies that focus on caring for the body, mind, and spirit. Services at the Integrative Medicine Center include help with nutrition, physical activity and stress, massage, acupuncture, music therapy, and meditation. The Integrative Medicine Center also offers group classes that are free and open to all patients, family members, and caregivers. But to make an appointment with an integrative medicine practitioner, ask your doctor for a referral. At MD Anderson, you have access to a variety of spiritual care resources. The Spiritual Care and Education Center offers spiritual support to patients, caregivers, and family members. They can also help you find other spiritual resources in the community. The chapel and spiritual support is available 24 hours a day. We have scheduled worship services and meditation and prayer rooms available too. You may also find information and support through the My Cancer Connection program. This volunteer services program connects patients, survivors, and caregivers with trained volunteers who have had the same or similar diagnosis, treatment, or experience. To meet some of our volunteers, visit the Hospitality Center in the main building for coffee and refreshments. You can also learn more about My Cancer Connection online and in your Resources and Services Guide. Safety is everyone's responsibility. Our care teams prioritize your safety, and we'd like you to remember a few ways you can help. First, you are an important member of your healthcare team, and you have important rights and responsibilities. This includes telling your care team if you have a question about your medicines, procedures, care, or treatment. At any time, you can say, "Stop, I have a concern." MD Anderson patient rights and responsibilities are listed completely on pages 10 through 13 in the First Visit Guide. We encourage you to read them to know what you should expect and deserve here at MD Anderson. Next, wear your patient ID wristband. You receive a new wristband at your first appointment of each day. Check that your information is correct and wear your wristband to all of your appointments that day. When you see new healthcare providers, they will ask you to confirm your information. Keeping your hands clean can help prevent infections. The best way to clean your hands is to wash them for 20 seconds with soap and water. You can also use hand sanitizer. Remember, you may ask any member of your care team to wash their hands too. Next, know what medicines you take. Be sure to tell your doctor about all medicines that you take, including vitamins and supplements. My chart can help you keep track of this information. Review your medicines in My Chart to make sure they are correct. Finally, remember to ask your pharmacist if you have questions about your medicines. It's important that you and your caregivers have all the information you need to take your medicines safely. There are a few ways you can prevent a fall while you are here. Wear safe shoes that are good for walking. Closed-toe, skid-proof shoes are best. Remember that you have options for getting around when you do not feel like walking. You can take a shuttle or use a wheelchair. Wheelchairs are placed in several locations around the hospital for patients to use. Finally, you may feel more comfortable using the elevators instead of the escalators. Choose options that help you stay safe each time you are here. As a patient, it is your right to receive clear and complete information about your care. In addition to your talking with your healthcare providers, there are resources at MD Anderson that can help you find answers to your questions. My Chart is a website and mobile app that helps you manage your health information. You can use My Chart to send messages to your healthcare team, schedule appointments, see your test results, and ask for prescription medicine refills. You can also access patient education materials on My Chart, like information documents and more videos. If you do not already have an account for My Chart, you will need an activation code to start one. For questions about how to set up My Chart or how to use it, visit the Learning Center or call askMDAnderson. askMDAnderson is a direct way to speak with a health information specialist by phone. askMDAnderson is a convenient way to get help with any of your questions. Health information specialists can help you make an appointment, help you with practical things like parking, and answer questions about topics like clinical trials or treatment options. You may also call askMDAnderson if you need to talk with a nurse about symptom-related questions after clinic hours and on the weekends. When you are here at MD Anderson, staff members at our information desks are ready to help you in a variety of ways. Stop by a desk for help with printing your appointment schedule or finding your way around. Staff can also help you find information about other resources. Information desks are open all 7 days of the week. The Learning Centers are patient education libraries with the latest information about cancer care, support, prevention, and general health issues. You can visit a Learning Center in both Mays Clinic and the main building. Each location has staff to help you find books, pamphlets, DVDs, and health and medical journals. To help you find accurate information online, the Learning Center has created recommended resource guides available on its website. Recommended resources lists are organized by topic for easy searching, and the Learning Center staff updates them regularly. You can also visit the Learning Centers for computer and internet access. Copying, scanning, and faxing are available for free. For leisure reading, visit the Patient Relaxation Area in the main building. The Patient Relaxation Area is managed by Volunteer Services and offers a library where you can check out leisure books. Classes are another way to get information. Your doctor may refer you to a specific class, but classes are free and open to all patients, family members, and caregivers. We offer group classes on education, mindfulness, and physical activity topics including nutrition, laughter yoga, Tai Chi, and other yoga classes. Most classes have a regular schedule, but the best way to know what classes are happening is to pick up a copy of the monthly class calendar. The Lunch and Learn class is a special type of class we offer every second and third Tuesday of each month. Lunch and Learn classes are led by different MD Anderson experts and cover different topics related to cancer. Lunch is provided. This class, like the others, are free and open to all patients, caregivers, and family members. You can find more information about all classes in the monthly class calendar. Now we're going to talk about how to get around MD Anderson. I'll give you some tips for finding your way, but the most important thing to remember is that you can always ask an employee for help. We are happy to help you find your way. MD Anderson offers a free ground shuttle service to bring you from one MD Anderson building to another. Travel routes for the ground shuttle bus are found at the entrance to the main building and Mays Clinic. Within MD Anderson, on the main sky bridge, we have a free cart service that travels between the main building, the Rotary House, and the Mays Clinic. The carts are available from 6 a.m. to 8:30 p.m. Monday through Friday. Once inside MD Anderson, we have a wayfinding system to help you find your way. The system uses landmarks, pathways, signage, maps, and other tools to help you navigate. Landmarks are places throughout MD Anderson that help you know where you are. Examples of landmarks include the aquarium, the tree sculpture, and elevators. Pathways are public highways that connect the landmarks together. They are clearly marked with blue stripes on the carpet. Follow a pathway from landmark to landmark until you reach where you want to go. At most entrances, you can pick up a pocket guide to help you find your way, or you can visit the wayfinding website at www.access.mdanderson.org. Here, you can view or print customized driving or walking directions. You can also use it on your smartphone or mobile device. The MD Anderson app also has direction information. The app can be downloaded for free on iPhone's App Store or Android's Google Play.
When we first arrived, we were like the proverbial deer in the headlights. It was quite overwhelming. When we first walked through the doors, it was like, oh my goodness, where do we go? But they have that wonderful help desk, and so you go there and you get your schedule printed if you need it, and get the map, and they are more than happy to direct you in the right direction. So we asked a lot of questions. We would stop and say, do you know where this is? Or do you know where that is? Or how can I get to such and such? And as we become experienced, it's kind of like a second home now, because I feel very comfortable, going around. And you recognize those that are new. So my family and I would always stop to help and say, can we help you find something?
Here's another look at the map of MD Anderson with our landmarks and pathways. You'll see similar maps and signs around the hospital to help you. The next time you visit, you may want to pick up a pocket guide map from an information desk. Shuttle services are available to make things a little easier for you. Look for the icons for Skybridge carts and ground shuttle services. On your map, the icons show where the carts and shuttles stop. Skybridge carts go between the main building and Mays Clinic, and ground shuttles can take you to the main building, Mays Clinic, Radiology Outpatient Center, Proton Therapy Center, and hospitality apartments. In addition to these services, shuttles are available by request to take you to other MD Anderson buildings. You can find the phone number to request a shuttle in your Resources and Services Guide. On your first visit, valet parking is free. After that, valet services are $15 a day, and parking garages are available. Parking garages have hourly rates up to $13 per day. Garages 2 and 10 are nearest to the main building, and the Mays Clinic garage is available if you are going to Mays Clinic. Off-site parking is available at the South Extension lot for $7 a day. If you park there, Texas Medical Center shuttles are available that stop at MD Anderson. If you park in garages 2 and 10, discount parking rates are available with prepaid passes. For example, you can get $60 in parking value for $52. These passes are available to purchase in garages 2 and 10. This may be ideal for you if you plan to park for several days for repeated visits. The Texas Medical Center also operates shuttles that stop at MD Anderson. These shuttles go to other places in the medical center, including off-site parking lots and the Houston Metro bus and rail stations. Our staff at the information desks can give you more information about the most current Metro bus and rail routes and schedules. To see a map of the Texas Medical Center area, TMC shuttle routes, and information about parking rates, pick up a copy of the Visitor Parking Pamphlet. Now, I'm going to guide you through some information about travel, dining, and other amenities at MD Anderson. MD Anderson has a full-service travel agency that may help you with your travel plans. They can help you find discount prices for hotels and transportation, including flights that can be changed without penalty fees. The travel agency can also provide you with the latest information about shuttles to and from Houston airports. The Rotary House is a hotel owned by MD Anderson and is operated by Marriott. The hotel connects to MD Anderson buildings and offers rooms with refrigerators, microwaves, dishes, and several amenities. Making reservations at this hotel is similar to another Marriott hotel. They will ask for your medical record number, but rates and room availability change. The best way to get this information is to call the hotel directly. Joe's House is an organization that can help you find housing options with discount prices for patients. You can call Joe's House for help or use their website to search for nearby hotels and housing. If you'd like additional help searching for housing in Houston, your social work counselor can help. There are 3 main cafeteria-style dining options, each in a different building. The primary dining option in the main building is Cafe Anderson. In Mays Clinic, the primary cafeteria is the Waterfall Cafe. The third cafeteria, located in Pickens Tower, is called Lantern Cafe. All of our cafeterias are open for breakfast and lunch hours, but only Cafe Anderson is open after 3 p.m. If you are looking for coffee or a light snack, there are several coffee shops around that sell Starbucks coffee. Cafe in the Park is the only dining option open 24 hours a day. You can also find snacks, sandwiches, and Smoothie King drinks at Cafe in the Park. Apicius is the only full-service restaurant and bar at MD Anderson. It is located at the Rotary House Hotel and offers breakfast, lunch, and dinner. Finally, a different option is the food court called the McGovern Commons. Most people call this place the Commons for short. The Commons isn't part of MD Anderson, but it is located just next to the Mitchell Building near Elevator J. Food options there include Starbucks, Chick-fil-A, Subway, Thai food, barbecue, and others. Finally, I'll highlight some services that may help make your time at MD Anderson more convenient and comfortable. We have laundry services available 24 hours a day. The machines are credit card operated, and the gift shops have laundry detergent to buy if you need it. There is a post office in the main building that is open Monday through Friday, 9 a.m. to 3 p.m. And there is a beauty and barber shop available on campus. You do not need to make an appointment to go, but services are for patients only. The last part of this class is about other places and services available to you. Some of the places may be related to your care, and others are for leisure. The Release of Medical Information Office is where you go if you want to request a copy of your medical images and films, pathology slides, and radiation oncology records. Locations are available in the main building and Mays Clinic. Blood donation centers are available in the main building and Mays Clinic. There is also an off-site location near the medical center. Blood donations from family and friends are welcomed and help us continue our patient care. If you have a medical emergency, you should call 911. Your healthcare providers will make sure you know what signs and symptoms to look for and when you need to go to the emergency center at MD Anderson. Knowing where it is may help reduce stress and anxiety. Our emergency center is located on the first floor of the main building. The outside entrance is located on Bates Street, across from Garage 2. Now, let's review some leisure places you can go when you have downtime. The park is one place in the main building that feels different from the hospital rooms and hallways. This space has natural light and feels like an outdoor courtyard. Gift shops and cafe in the park are nearby. Also in the park, Kim's Place is a space for kids between the ages of 13 and 30, whether they are patients, siblings, or friends. The space has video games, a pool table, large TV screen, and computers with internet access. If you'd like a quiet place to go, the observation deck offers a nice view of Houston and a relaxing environment with TVs and a piano. To get there, you need to change elevators on floor 22. The Prairie offers an outdoor space to walk or enjoy some fresh air and native plants. This space has benches and picnic tables. You can also visit a small garden and see seasonal wildflowers here. Finally, for a quiet place to rest and relax, visit a hospitality center. These spaces are managed by our volunteer services and offer comfortable chairs and refreshments. This is the end of the presentation. Thank you for listening. If you have questions or feedback to share, call or email us at the phone number and email address listed on your screen.